So thank you for having me here. I'm really excited and happy to be part of this today. And my name is Javier Pizones, and I work in Madrid, Spain. As I've been a spine surgeon for the last 18 years, very involved in deformity and scoliosis. And I'll tell you a little bit what we have been doing in the last 2 years. And this is mainly work that my mentor, Paco Sanchez, has done. He's already retired, but he wanted to know what happened to the patients he operated on 30 years ago. So 30 years ago, in the 80s, there was this phenomenous change in surgery. The CD instrumentation, which is the one that you see here, came out, and it replaced the one that we had before. That was the Harrington instrumentation. It was only one rod, and then you had to be 3 months after your surgery laying on bed and with a cast, and then you needed 18 months of subsequent bracing. Now, this CD instrumentation that came in the 80s changed completely the paradigm, because as we do today, you operated the patient could freely move afterwards without needing of bed rest and casting. So here, what we wanted to see is those patients that we followed in the 80s and treated by conservative means and then got operated by the age of 14, 15, more or less. What has happened to them in these past years, now that they're 50 years old? What happened in these 30 last years? So for that, we wanted to collect the experience and current attitude of those patients operated back in the 80s with this instrumentation. As you see here in the pictures, the guy with the mustache is my mentor. He operated on all these patients in the 80s and wanted to follow 30 years after that. For that, we did a prospective qualitative cross-sectional study using one thing that is used in psychology. And this is completely different to what we usually do. We usually use something called prompts, which are questionnaires, multiple choice that you can fill in. This was another idea. The idea was to have an interview, 60-minute long, and let the people talk and see what happens. So he was the guy. So my mentor was the one calling the patients and offering them a semi-structured personal interview. It was undertaken by him. More or less, it was 60 minutes. And there was a topic guide that was done by our research team based on 7 different topics. The registry identified 284 patients, but we could finally contact 103, and 100 were interviewed. And there was a very common quote. People felt like they were getting a call from the past. So they really remember 30 years back what happened, and they remember the surgeon and the experience they had. Mean age of the patients now were 47 years old, the mean follow-up 30 years. So the interview covered two different times. First, in the adolescence, what happened, the recollections they have on their conservative treatment and the experience of surgery itself. And then in adulthood, what has happened in these last 30 years regarding adjustment to social environment, back health, physical activity, and current health conditions. And actually, at the end, we wanted to see the overall satisfaction with treatment. But during the conversations, a lot of different topics, subtopics arose. And what we did here is to collect more or less what was common between patients to guide the conversation and have the final results. So the recollection they had from the initial conservative treatment, that being cast or braces, or we did way back before we did electrostimulation or night traction, it was really hard. So they really complained regarding the intensity of those treatments. And there was a group of patients that were really affected by these treatments. And we have to remember that at that time we did traction, and some of them said that they had nightmares till they were 25 years old, or that some of them with night tractions cheated releasing the traction during night while their mothers were not watching. For the decision of surgery itself, many patients were driven by the parents' opinion. You're 14 or 15, so you don't make the decision yourself. Your parents usually do the decision for yourself. And the doctors really encouraged this new strategy and instrumentation that we had, and they could experience that. And the experience of surgery was positive. The same thing as the conservative treatment, had very bad memories, almost in all patients. The experience of surgery was positive. The worst experience were the posterior approaches, double approaches. So when we have to go from the back and from anterior, the resuscitation room or the complications, if there were any. And at that time, we didn't have neuromonitoring during surgery. So those are the cables that measure how your cord is functioning during surgery. And we had to wake up in the middle of the surgery patients to see if they could move the feet. And some vividly remember that wake-up test, and we were surprised about that. Regarding social environment, work and jobs is pretty much the same as in the normal population. So those guys that wanted to study could study a career, and those that wanted to go ahead and work from the first day, they could. Some of them complain of back pain, but it's very similar to the general population, and only 8 had benefits. But we were stuck on one patient, and we really realized with this that we're changing patients' lives. And this was a guy who said that the operation came just when he got an engineer scholarship in university, and he had to give up that scholarship and ended up as a truck driver. So we can really impact on patients' lives. 2/3 of them were married, 2/3 had offspring, and it's really common that you don't receive the epidural anesthesia during birth. Some of them voluntarily didn't want, but some that doctors failed to attempt that anesthesia or secondary to doctor's decision. But we only have 4 C-sections. And we have quotes like, I don't have not wanted to have children because the possibility of transmitting the scoliosis is one thing that stuck us. And I think I haven't had children because the amount of radiation that we receive, and we know that radiation is a big concern among our population. It is true that right now the radiation exposure is much less than it was in the 80s, but still we have to struggle with that. Regarding physical activity, 50% were very active, and you can see that almost 43 of them, so from the 100, could do sports like soccer, skiing, boxing, horseback riding, Pilates, and there are very, very few that felt limitations. So we have from one range that I feel physically very restricted to another range that I could, go with a group of bikers, sometimes in routes, very long routes. So there's people doing a lot of things, a lot of sports. Main issue was back health. So back pain, we encountered in 72% of the patients, and some of them were actively treated. But we have to remember that in a normal population, in this age, which is around 50, 65% already disclosed lumbar pain. So it's a little bit slightly higher than in a normal population. This is the important thing. Self-image was not good. So you are mostly dissatisfied with the deformity and the scar. And some of them complain, and you could see here from a residual hump up in the left, or prominent implants down on the left, or maybe with time, with degeneration of the discs that we have below the instrumentation, you can fall anteriorly or to one side. And most of the patients that we interviewed complain of back stiffness. And that is really true, because nowadays surgery is a fusion. So they have perceived back stiffness, rotating the trunk, especially towards the convexity. On concurrent health conditions, we found 3 patients had breast cancer, which is very similar to the rate we found in the normal population, slightly higher. 9 were depressed, 4 had pulmonary pathology. And again, we felt the concerns about the accumulation of X-rays and if that has something to do with cancer. And overall satisfaction with the treatment was good. So most patients were satisfied with the treatment received, although we felt that some of them still have a stigma, because you have scoliosis and you're going to live your life having scoliosis. You're not like a pure normal. You can do normal things and normal activity and work, but you always feel that you're a little bit different than the rest. So quotes like, I have to give up my ballet and I cry for a year, or sometimes I dream that I don't have scoliosis, which really is impactful. And all of them were satisfied. They were satisfied with the work we were doing in the interviews, because they got to reach the original surgeon that treated them 30 years before, and because actually they felt that they were talking to someone that could really understand what they were have experienced through life. So at the end, factors such as dissatisfaction with self-image, low back pain, and spine stiffness were relevant to these patients. But despite this, the great majority were satisfied with the treatment they have received and has allowed them to lead an integrated life in society. So thank you. Thank you for listening to me. If you have any questions, Dr. Soufflegard, do you know that if any from the audience have any questions already?
There are no questions from the audience. I have a question. This is a tremendous study that you guys undertook. How many ancillary people did you have working with you? Or did Paco do it all himself?
Paco did all the interviews himself, so we were three working in this, research coordinator and myself, that I could lead a little bit and organize, but the interviews were undertaken by Paco himself, who operated these patients 30 years ago. It was really happy by doing this. It's very difficult, and actually some of them came together with their mother, actually parents, but mostly mother, because they wanted to see face to face the surgeon that operated on their kids 30 years ago. It was an experience for both of them, I think, patients and surgeon. Right. Really positive. Yeah.
Paco's been a good friend of mine, and I admire him for undertaking this study.
Yeah. So we could see here that actually what we've learned about this, it's that they lead a normal life. Well, Lindsay is here, can tell us, and Eve can tell us afterwards. They can lead a normal life. They don't feel like their peers, so they know that they have this thing, and they have a stigma, a small mental scar, if I could dare say. But actually, they can work, they can study, they can live normal life, they can get married, they can have children. Here we have Lindsay, and they do have back pain, very similarly to the population, but they do have back pain at this time. And they know, I think they acknowledge that they have to be active in sports, and they have to take care of their health if they want to be more productive and without pain for the rest of their lives.
I have another question for you. Do either you or Paco think we're doing any better now than we did 30 years ago?
Yeah, hopefully we are. I think new instrumentation has improved, and I think radiation exposure, for example, is less, because the machines we're using right now have less power of radiation, and people are more concerned that they have to live a healthy life and diet and all that. So I think we're doing better, but we need another 30 years to demonstrate that we're doing better than what we did 30 years ago. But I'm positive on that. Yeah.
I see a lot of my old CD patients back, and most of them do pretty well, but not all of them.
Yeah, you have to remember that on those times, 90% of the instrumentation was T4 to L4, which we don't do anymore. Now we do selective fusion, so we leave the lumbar spine free to move, and this is a step ahead. I think it will improve the results with time.